So there are certain kinds of things that might make me wonder whether someone would meet diagnostic criteria for borderline personality disorder. So one of them is that they may harm themselves when they're really distressed or have frequent suicidal ideation or a history of suicide attempts. Very often they've also had a history of help seeking and maybe other diagnoses in the past. They also often have a history of very unstable relationships. So maybe very intense attachments, which then fall apart in a kind of explosive way. There is also a strong link between meeting the diagnostic criteria for borderline personality disorder and having had adverse childhood experiences. There's all kinds of traumatic things that can happen to young people that result in them finding it very difficult to regulate their emotions, and then that is what we call borderline personality disorder, or part of it. So the diagnosis of personality disorder is something that's made over observation over a longer period of time, and would probably be ideally done by an expert mental health clinician, like a psychiatrist, a clinical psychologist, a mental health social worker, other people with experience, and also the time to engage with that person in the longer consultations and observe over time. The GP's role really is to be alert for the symptoms of distress, which is at such a level that the person really needs to have help now. There needs to be a good therapeutic alliance. So if I refer the young person on to a clinician or a DBT group or something like that, I like to see them again and actually check in. Do you feel comfortable with your clinician, with that group? And I wouldn't necessarily change the referral if they're not, but it might be an opportunity to have a talk with them about how we could make it better for them, or to have a conversation with the clinician. Something I think GPs can do really well is giving them some skills to help calm themselves. We can become familiar with 2 or 3 of those affect regulation strategies, relaxation strategies, if we're looking at a CBT basis, that we can use with people in our rooms to help them calm themselves, and then ask them to practice it at home and then check in with them next time. It's quite important that the young person leaves your room feeling better than when they came in. And one of the things around that is conveying a sense of hope. I maybe wrap up the consultation with acknowledging the difficulties, and then I end with acknowledging the things that they're doing well and that they've come and that there is hope for getting better. Maybe some of us have come from a kind of medical culture where BPD was considered something from which you couldn't recover. That's not accurate. So there are effective treatments for borderline personality disorder and for this level of distress. And particularly if people can be detected and picked up and referred early and have good collaborative care over time, they can recover, and they can learn to regulate their emotions and have effective relationships and effective employment, education, study. They can often catch up ground that's been lost and go on to have normal lives. And one really exciting thing is that they can actually sometimes break the cycle of distress that's been passed down through generations.